Nexus DMS Limited is a specialist Worcestershire-based manufacturer of high-quality professional-grade electric profiling care beds, bariatric products, mattresses and pressure care accessories. The Legacy Turning Bed has been designed and manufactured for the treatment of complex trauma, including multiple injuries, spinal and spinal cord injuries. It represents a 21st century solution for turning and handling patients with complex injuries or care needs. Its operation has been designed to reduce the physical strain for healthcare workers as much as preserving patient safety during turning and transfer. The right pedal makes the bed raise and lower. The centre pedal is for left and right tilt, and the left pedal is for head up and head down positioning. There are sets of pedals located at the head end, the foot end, and both sides. There are also a number of hand switch controls. These operate the side wings, back lift, and self-leveling capabilities of the bed. To start operating the bed, first insert the safety key. This will give you full function or limited function depending on the key inserted. When the key is removed, the system is isolated. Press the black button once and the system active green indicator light is illuminated. The bed is now fully operational. Press it a second time and the system is isolated. The bed will now not operate, but the onboard batteries will still be charging. The red button is for emergency stop only, and it cuts all power to the bed along with battery charging. Firstly, please ensure the patient is centrally positioned with their head 2 centimeters from the top of the viscoelastic top mattress. As can be seen, some spinal patients do not generate sufficient heat in their lower limbs to activate the thermal contouring properties of the mattress and will require their heels to be supported off the mattress by pillows. Raise the side wings on the side of the bed you wish the patient to be turned onto. The operator is to use the ×2 button on the side of the bed with their hand placed between the side of the mattress and the patient. This will help the operator judge when to stop raising the side wings and also to reassure the patient. Next, trim up the contact between shoulder and hips using the ×1 button at the head or the foot of the bed. The turning team are now to manually brace the patient, but remembering to not actually turn them manually. The 5th member of the team is now to operate the left and right tilt as instructed by the lead member to the desired angle. The patient has now been safely turned with minimum risk to themselves or the turning team. When turning the patient to the opposite side, assemble the team as before and rotate the bed to the horizontal position, allowing the mattress time to react to the patient's body temperature before commencing the turn. When the patient is at a 30-degree side tilt, reassemble the turning team. First, stabilize the head. The lead will instruct the 5th member, who is at the foot of the bed, to lower the appropriate side wing using the ×2 button. When the 2nd team member feels the patient's weight transfer, they must instruct the team to engage, which also tells the 5th member to return the bed to horizontal. The turning team will now gather the patient towards them as the side wing lowers. The 5th member will simultaneously lower the appropriate side wing whilst returning the bed back to the horizontal position using the appropriate foot control. The 5th member can now carry out the required patient care. To return the patient to the previous turning position, simply carry out the assisted log roll in reverse order. When instructed by the lead, the 5th member will raise the appropriate side flap with the end ×2 button at the foot of the bed. They will simultaneously raise the appropriate side of the bed using the left or right tilt, thus returning the patient to the previous turned position. The turning team will lower the patient to supine as the bed tilts. The patient is now centered in the bed. Patients with an unstable fracture must be braced and secured on a scoop stretcher or a spinal board. Glide sheets must be placed under the scoop or board, and the transfer board to be placed as far as the patient's shoulder between glide sheet and bed. The bed should be angled with the transfer board between the bed and the trolley with the transfer team, as shown here. On command from the lead, the bed team will coordinate a gentle push of the patient halfway between the bed and the trolley. The receiving team should then gently pull the patient towards them on the command of the lead. Please note, if the bed team push too hard, the patient could slide the full distance under gravity. This procedure can be used when transferring a patient to CT or MRI scanners and also onto the operating table. To transfer a patient from the trolley to the bed should be angled down towards the trolley with the patient transfer board between the bed and the trolley. On command of the lead, the trolley team will gently push the patient halfway between the trolley and the bed. The receiving team should then gently pull the patient towards them on the command of the lead. Again, if the trolley team push too hard, the patient could slide the full distance under gravity. This procedure should be practiced fully. The Legacy Complex Care Turning Bed, a unique patient turning solution within major trauma, critical and complex care.